Hi everyone, I am Shahan. Welcome back to my channel, and in this video I will discuss about diabetic ketoacidosis. What is diabetic ketoacidosis? Let me discuss in details what is the definition, what are the signs and symptoms, everything you will learn from this video. So watch this video continuously and you will get a lot of knowledge from this video. Now, why I have created video on diabetic ketoacidosis, because this is a very hot topic, and several times it is asked in NEET PG, and also in the PLAB examination. It was also asked in FNG examination. So let's get on to it. So what is diabetic ketoacidosis? Basically, before telling you the definition, because whenever I try to explain definition to my students try to run away. So before telling that, let me tell you what is diabetic ketoacidosis in short. It is actually a condition of our body in which the insulin level decrease and the ketone levels are very high in the body. There are a lot of ketone, and as insulin level is low and ketone level is very much more in the body, so the person will get acidosis, and that is why the name came diabetic ketoacidosis. And generally it is found in diabetes type 1 patient, so it is related with diabetes, and that is why it is known as diabetic ketoacidosis. Now look at this slide. You can see so many symptoms of diabetic ketoacidosis. These are very important. Number one is high blood sugar. This is very important. Whenever a patient comes to you in the emergency with diabetic ketoacidosis, you have to check the blood glucose level. This is very important. You just take the AccuCheck or other glucometer machine, and you just check the blood sugar level of the patient. High blood sugar level, this is very important. Sometimes the glucometer shows H in the marker. It means high, very high. And another is being very thirsty. The patient is very much thirsty. That is very important. Another thing, when you will come near to the patient, you will find sweet smell breath. This is very important. Sweet smelling breath of the patient, and the smell of the patient's breath will be just like a nail varnish or pear drop sweets. So all these are the types of smell. It is very sweet smell you can find out in the breath of the patient, because the patient has a lot of ketone bodies in the body. So as the ketones are more, ketones are actually the acids. So as ketones are built up in the body, so the patient is having acidosis, and that is why this is coming out through the breath of the patient as sweet smelling breath. Sweet smelling breath, very important. The patient will be very much thirsty, so the patient would be asking for water. When you will be in the emergency, you will find out the patient is asking for water. The patient is very much thirsty. Next is blurred vision. The patient cannot see properly because there is blurring of vision. Very important, blurred vision. Another thing, the patient always would want to go to the toilet, so needs to pee more often. Why the patient needs to pee more often? Because there is a build-up ketones in the body. As ketone bodies are more, the patient will try to go to toilet more. So needing to pee more often because the patient is having high ketones. Next is stomach pain. Very important. The patient will complain of abdominal pain, stomach pain, and the patient will feel very much sick. So stomach pain and feeling sick. Another very important thing is the patient will be confused. The patient will have a lot of confusion and passing out. Very important symptoms of the patient is confusion and passing out. Another symptom is feeling very much tired. The patient will be very much tired. You can understand from the patient that the patient looks very tired, the patient looks very sleepy. All these things are very great characteristics of diabetic ketoacidosis. Immediately when the patient gives all these symptoms, like the patient is thirsty, the patient has a sweet smelling breath, the patient has high blood sugar, the patient has blurred vision, confusion, stomach pain, and also the patient needs to pee more often, you will suspect that this patient is having diabetic ketoacidosis. So you will take the history of the patient, and the patient will give you the history of type 1 diabetes. Mainly type 1 diabetes patients has this kinds of symptom. Sometimes it can be also found in type 2 diabetes also, but diabetic ketoacidosis is a serious condition that affects type 1 diabetes. Very important, type 1 diabetes. Most commonly found in type 1. It came in several times in NEET PG and FMGE. So remember, type 1 diabetes is mostly common for the diabetic ketoacidosis. It is in short, it is known as DKA. Okay. And another thing, what is DKA? Now let me teach you definition. Now it's your turn to learn it. Now what is DKA? DKA is basically diabetic ketoacidosis in which there is severe lack of insulin. The insulin level is very low. The insulin level has fallen down in the body. That is known as diabetic ketoacidosis. And this means the body cannot use the sugar for energy, because we need insulin for utilizing the sugar for getting the energy, but the body cannot use the sugar for energy. So what will happen? The body cannot get insulin, and the body cannot utilize the sugar and get energy. Then what will the body utilize? Now the body will do lipolysis. Now the body will utilize fat, lipid, and that is why this diabetic ketoacidosis is a cause of lipolysis. In several book you will find the diabetic ketoacidosis is related with lipolysis. What is the meaning of lipolysis? Lipo means lipid, lysis means breaking down. So the body will start breaking down fat, and it will produce a lot of ketone bodies. Now what are the ketone bodies? There are three kinds of ketone bodies: acetone, acetic acid, and also beta hydroxybutyric acid. All these are the ketone bodies. So we have learned what is diabetic ketoacidosis. Now look at this picture. This picture is actually telling you the initial warning signs of ketoacidosis from the diabetes. So you can see what are the initial warning signs. Whenever the patient complains of thirst, or whenever the patient is at home, but the patient is very much thirsty, the patient has dry mouth, very important, dry mouth, very dry mouth. The patient feels that all these throat and his mouth and the buccal cavities has very less amount of saliva, very less amount of water, and so the patient will complain of dry mouth. The patient will try to take a lot amount of water. The patient is thirsty, and the patient will go to urinate again and again, frequent urination. And immediately, if you check with the help of the glucometer, you will find out that the patient is having high blood sugar. Very important, very high, spiked blood sugar. Sometimes the glucometer shows H, I told you. And another thing, if you check the ketone level in the urine, like the high ketone level you will find in the urine. That is very, very important. Now, what are the signs and symptoms of diabetic ketoacidosis? Already I have told you, but remember this 4T. These 4T are very important for diabetic ketoacidosis. Number 1 is toilet. Number 2 is thirsty. Number 3 is tired. And number 4 is thinner. So these are the 4T: toilet, thirsty, tired, and thinner. Toilet, the patient will again and again go to urinate. So toilet, T. Next is thirsty, the patient will drink a lot of water, so thirsty. Next is tired, the patient looks very much pale, very much tired, the patient will look sleepy, so tired than usual. Next, the patient will be very much thinner, the patient will lose weight than usual. Now, why the patient lose weight? Do you know this? The patient lose weight because the patient is having a lot amount of ketone in the body, so that is why the patient is losing weight. Now, how can we diagnose diabetic ketoacidosis? This is also very, very important. We can diagnose diabetic ketoacidosis by number one, the blood test, that is blood sugar test. Now, you will do the random blood sugar test, random blood glucose test, RBGT. RBGT means the random blood glucose test. You will check with the help of the AccuCheck, with the help of the glucometer, and if you find that the patient is having higher than 250 millimeter per dl blood sugar, then you will find out that the patient is having diabetic ketoacidosis. Not only that, you can also check the blood acidity. The blood acidity is generally tested by the arterial pH. So when you check the arterial pH, you will find out that how much blood is acidic, because it is a acidic condition. Other test can be the ketones. So when you check the ketones in the blood, it can be done with the help of ketone meters. These are the meters which measures the ketone bodies in the blood. You can check it and you can find how much ketone is there. And you can also do urine test for the ketone. So generally the urine carries the lot amount of ketone. It flows a lot amount of ketone. So ketone are excreted through the urine. So you can check it by urine analysis for ketone. Urine analysis, urine test for ketone. And another thing, you can also check the BUN, blood urea nitrogen. You can also check serum creatinine, osmolarity, all these things, and how much consciousness the patient is having. So the level of consciousness also give you the idea. You can also check the KFT, that is the kidney function test, because these patients often has diseased kidney. So kidney function test, sometimes due to diabetes, it affects the kidney also. So KFT, and also you can check the serum electrolyte test. So all these things you can check and you can diagnose the patient is having diabetic ketoacidosis. Now this is the picture of the glucometer. You can see the patient is being pricked with the help of a needle from the tip of the finger, and blood comes out, a small amount of blood. It is a little blood, and you just take the glucometer there and you just put a stripe there inside the glucometer. You can check the stripe is being added, and then the stripe is touched with the blood, and the blood will go inside the stripe, and you will get immediately the measurement in mg per dl. You can see the 108 mg per dl this patient is measuring and getting the report immediately. So whenever the patient is having all the symptoms of diabetic ketoacidosis, like increasing thirst, urination, abdominal pain, and low level consciousness, and all these things the patient is having, you will suspect the patient is having DKA, and immediately you will take this glucometer and measure the glucose level. That is very important. Now, how can we prevent this condition of diabetic ketoacidosis? This is very, very important. Basically, we need to know how can we prevent this condition. To prevent diabetic ketoacidosis, basically it happens in patients with type 1 diabetes. So the patient is already having some diabetic diet plan. The patient is already consulting a dietitian or endocrinologist. So first of all, the patient need to follow the diet plan. The patient must follow the diabetic diet plan as prescribed by his or her doctor. Number one. Number two, you can talk to your diabetic doctor. You can consult endocrinologist and always maintain the target HbA1c. Do you know what is HbA1c? HbA1c is a kind of blood test where you actually get the average of the glucose for 3 to 4 months. This is very, very important. So it is actually an average. HbA1c is the average, and if you can maintain this average, the doctor will say you the normal range, and if you can maintain it to the target HbA1c, then you can prevent it. Next, you must do frequently the blood sugar test. Other things I already told you, like follow a diabetic diet plan, consult your endocrinologist, consult your diabetic doctor often. Sometimes the patient who is having diabetes type 1 or diabetes patient, they consult their dietitian very less frequently, and that is why they get a lot of blood sugar. They do not check the blood sugar often, and they also do not maintain the HbA1c. All these can actually lead to diabetic ketoacidosis, which is a serious condition and need emergency management. And whenever the patient comes in the emergency with diabetic ketoacidosis, generally the patient is given insulin immediately. So you have to remember, diabetic ketoacidosis is a serious condition, so we can prevent it. So for the patient who is having type 1 diabetes, they need to maintain the target HbA1c. They need to check frequently their blood sugar level. They need to follow the diabetic diet plan. They need to consult and talk to the diabetic doctor very often. And they also can work with the other care member team. They will help them to manage diabetes very well, and they can consume digestible food. Another thing, you can see this picture. This is actually a diabetic ketometer, and it is known as keto sticks. You can see the name KETOSTIX. So keto sticks are actually the ketone measuring instrument through which you can check how much ketone bodies are there inside your body. So this is the end of this video. If you like this video, make a thumbs up and please write down in the comment section below, because this inspired me to make many videos like this. Thank you. Have a nice day. Bye bye, and don't forget to subscribe this channel. Bye bye.